Less surgery when work comp injuries. Start care with the right provider. Folks, this one can change lives for injured workers. Hey, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and as you'll see in just a sec, this is vital and can save you or someone you care about from having unnecessary surgery. So make sure you tell somebody about this video. Share it for me. Now, we don't always think that it matters much when it comes to choosing which provider we're going to start care with when we get hurt. Most doctors, they know their stuff and they do what they can to prevent more invasive procedures like surgeries, right? Well, it turns out that that's not necessarily the case according to the state of Washington. This research cannot be discounted as biased chiropractors doing their own research to try to prove a point. Absolutely not. As mentioned, this is from the state of Washington, their statistics for their injured workers. They wanted to know if there were early predictors that could tell whether or not an injured worker would go on to have spinal surgery or not. Specifically, they wanted to find out if an injured worker would go on to have spinal surgery in the next 3 years after they got hurt. Well, they point out that back injuries are the most prevalent occupational injury in the United States. And I'm going to add that low back pain is also the leading cause of disability globally. In addition to that, low back pain is overall more costly globally than diabetes, cancer, and heart disease combined. Just think about that for a sec. Think of the expense it takes to treat each of those. Diabetes, heart disease, and cancer, one of the most expensive things you can treat. And then combine all of that globally, and that's not even the cost of low back pain, right? Low back pain is more expensive than that. Wow. The point is that low back pain, it's a big deal. And if the right pathway into the healthcare system can be determined, well, then that would be worth pursuing, wouldn't it? In this particular study of Washington state workers, they studied 1,885 injured workers. In doing so, they determined that when a worker chose to see a surgeon first, they ended up having surgery 42.7% of the time. That's almost half. 42.7 is close to half. When they saw a surgeon first for their injured back, 42.7% of them had surgery eventually. And on the other hand, of those that chose to treat with a chiropractor first, only 1.5% of them went on to have surgery in the next 3 years. 42.7% who saw a surgeon first versus 1.5% who saw a chiropractor first had surgery. I would say that is a huge difference, folks, a big deal, and news worth sharing with others. Here at Creekstone Integrated Medical, we see workers' comp patients. We have a double board certified in orthopedics and forensics chiropractor. We have a nurse practitioner to provide medical services. We have an acupuncturist and 3 massage therapists, and we treat pain with a broad management multimodal approach, as the research and the evidence tells us to do, and we're good at it. Just this morning, we had a patient with a low back kind of pelvic pain that had already been to the ER and had already been to another local clinic here in town before making their way to us. She was told by the ER physician that she would need surgery. Here at Creekstone, our chiropractor and our nurse practitioner, we were able to quickly determine the issue. We treated the patient first. I treated the patient first. Then our nurse practitioner, Jason, performed trigger point and SI injections on her. And then she was taught very specific exercises for the issue. And then she left ready to go dancing. She did not leave, still convinced that she was broken or that she was headed to surgery. And that makes all the difference in the world. Even better, should our initial treatments had not been effective, we still had plenty of other things that we could use to treat her with here, including low-level laser, massage, acupuncture, and we just have so many options here. Under one roof, by the way. So if we can help you and your loved ones in the same way, you need to call us, okay? If you're from the Amarillo area or you're going to be passing through, call us at 806-355-3000. We can make a difference for you or someone you love. If you're watching me on Facebook or YouTube, be sure to subscribe, share, like, all that good stuff. Whatever it takes for you to do it, just tell someone so that we can help them too. Again, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas. Until next week, be safe, be smart, and we'll see you then.